But first, we're going to talk about some more serious topics, but we're going to do it with this amazing, amazing doctor. I want to introduce to you Dr. Elinore McCance-Katz, and she is a psychiatrist involved in so many different things, Able Americans, addiction counseling. She's a teacher at a medical school. She's done so many things, so we're going to have her on to talk about mental illness. Welcome to the show, Dr. McCance-Katz. I want to make sure I get that right.
Yeah, you got it. Thank you.
So thank you for suffering through my long introduction here. And so you recently had an article on Abled Americans, and that's part of the National Center for Public Policy Research. That's one of their many programs. They are an amazing company, or organization, I should say. So Abled Americans, I've had a number of people on over the years from them, and they take a look at, you know, mental illness is one of those topics that not everybody is comfortable talking about, but for heaven's sake, it's so important. It's affecting families, it's affecting our cultures. And you address the situation. You wrote an article about it, is that there is a gargantuan shortage of beds in hospitals for mental health treatment. So they end up in prisons, they end up on the street, they end up in, you know, they don't belong in prison when they are mentally insane and they don't know what they're doing. So tell us a little bit about what that situation looks like.
Well, there's a history to it. So back in the 1950s, Americans became aware that we had over 500,000 people living in state mental hospitals under really pretty bad conditions and not getting great care. And so there was an effort and an ongoing over the years. We closed down state hospitals. We closed down psychiatric beds. The idea being that we were going to put community mental health services in place. And President Kennedy signed a law in 1963 that was the Community Mental Health Services Act that was supposed to build these community mental health centers across the country. The problem was they were never really funded fully. And so we closed down hospital beds and we never replaced the services that could have been gotten from hospitals in the community. In addition, Medicaid passed in 1965, and that specifically excluded the payment of hospitalization for psychiatric or mental health needs. So people that had serious mental illnesses, severe substance use disorders were excluded from getting payment for services that they might need on an inpatient basis in hospitals. That's gone on to the present. And what happens is when you lose your hospital beds and you don't have enough treatment services, people get sicker and sicker and they end up on the street. They get into trouble. They sometimes break the law. They will get incarcerated. Sometimes their mental health issues get so severe that they'll end up in emergency rooms where they can sit for days to even weeks getting no treatment. And that makes for a situation where we have conditions that are terrible for people with these illnesses, but also for everyone living in our communities.
Wow, that's, I'm interested in hearing what are the numbers of those who are struggling with mental illness and if that has been on the rise, in the past decade or couple of decades. I wonder what the statistics and the data are as it relates to other programs that we are funding, for example, in our government. I wonder what the cost effectivity would be if we would really look into addressing this in a different way and from a different angle. What would you suggest is some of the best possible solutions going forward?
Well, first, I would say you're exactly right. The numbers of people with serious mental illnesses has gone up, particularly in the wake of the pandemic. And the number of people with severe substance use disorders has gone up a lot. And, we hear a lot about the number of people dying of overdose deaths. That number has gone up tremendously over the past few years. And so those are huge problems that we face as a nation. But what we need to do, I think, is a couple of things. One, we need to build out our community services, and we have a program that has been in place. Actually, it was a demonstration through the Centers for Medicare and Medicaid Services back in 2014. Congress put that in place. It's now in 2022, Congress passed a law to make this program, which is called the Certified Community Behavioral Health Clinic Program, available in every state. So going forward over the coming years, we will see these programs in every state. What's really important about these programs is that we know that people who have serious mental illness, people who have severe substance use disorders, don't have just one condition. They usually have more. Very often people have what we call co-occurring conditions, simultaneous substance abuse disorders and mental illness, and often with very serious physical health problems. What the Certified Community Behavioral Health Clinic program does is it brings together what we call integrated services so that people can get care for all of their mental health, substance misuse, and physical health care needs in one setting. Very, very important. But what we also must have for the safety of individuals with these very severe illnesses, as well as the safety of others, is hospital beds where we can put people into an acute care setting and give them very intensive care so that they can get their needs met and we can de-escalate what can be really volatile and dangerous situations. So we need that combination, the inpatient services plus the outpatient services. And then on top of that, we have a very big problem in this country with the number of people who are homeless. And we have about 270,000 people on our streets who are unsheltered homeless. And those folks, often 2/3 of them, have mental illnesses and or substance use disorders. And so we need to be able to pair housing with the mental health and substance abuse treatment so that people can recover and get back to productive lives in their communities.
Yeah, I know we've done stories sometimes where people were homeless and you have this big turnaround when they get the help that they needed. And I get it. You can't force people to take help, but when they're mentally ill and have schizophrenia. We're going to talk more. I know you work with veterans, and I want to talk a little bit more about this topic, so don't go away. We'll be right back.